welcome back to the On with Amanda Medicare podcast. Today I'm going to make a sincere attempt to address some of the news about Social Security, about Medicare, some things that you maybe have read online, and let you know the facts that I found and some of the effects that I'm seeing so that we can calm some of those fears, really tone some things down, and just take some proactive steps to not let some of the disruption affect what you need to accomplish with your Medicare and with your Social Security. So I do want to take a step back and kind of start at the beginning. I do want to talk about how these government programs are kind of funded, how they work, where they fit in the organizational chart. So I'm going to start talking about the Department of Health and Human Services. This is a humongous department. It's currently led by Robert F. Kennedy Jr. and handles agencies that you're probably familiar with, like the CDC, the FDA, the National Institute for Health, and also our favorite, the Center for Medicare and Medicaid Services. The Center for Medicare and Medicaid Services is a significant, as you'd imagine, department. Annual budget over $1 trillion, helping a lot of people get set up for Medicare, handling premiums, all those different things. So certainly important for the work that we do every day. I think the main headlines lately regarding Health and Human Services, particularly Medicare, is that there's been a lot of cuts there. So what is cuts going to mean for me, for processing times, for getting things done when I need to? The headline would read that 20,000 people have been fired from the Health and Human Services Department. That's a tremendous amount of people. I would reassure you, if it's reassuring, that only 300 of those employees have been from the Center of Medicare and Medicaid Services. The vast majority of those employees who are equally as important as Center for Medicare and Medicaid Services were on the CDC and FDA side. So Medicare has experienced a reduction in their workforce of about 300. So pretty insignificant portion of the 20,000 that you'd read in the headlines. As far as Social Security Administration, a lot of people think that that falls under Health and Human Services as well. Actually, it did until 1995 when it became its own government agency, currently headed by Interim Director Leland Dudek. Social Security Administration is its own thing. So anything that you hear in the news about Health and Human Services Department wouldn't necessarily affect Social Security because it is its own agency. But Social Security is the department that handles Medicare enrollments, Medicare premium payments. So even though they're not both under Health and Human Services, they both do have a significant impact on processing and claims paying and all of those important things. So the headline in the news is that 50% of the Social Security Administration workforce is going to be cut. In fact, if you go to the Social Security Administration website, they do talk about some layoffs. They've charted it for 7,000. They say that the 50% reduction is categorically false, so that's hopeful. And they even further explain that a majority of those 7,000 are people who are near retirement and maybe are interested in an early retirement package. I certainly, as a person and as a mom and as a wife, I don't want to downplay anybody losing their job or anything like that. I just want to be clear that some of the news headlines that you see can take more of a fear-mongering than a fact-based approach to their reporting. So at Medicare, we're working with or Center for Medicare and Medicaid Services, we're working with about 300 less employees. Social Security is expected to lay off about 7,000. So not 20,000 people and not 50% of the Social Security Administration workforce. I want to talk a little bit about how we can be proactive because there is disruption. Even if a lot of people aren't being cut from the workforce, I think that the messaging around it and the fear and some of the uncertainty is certainly affecting workflow. I've seen already that it is taking a little bit longer than normal for Medicare to process or Social Security to process Medicare Part A and or Part B enrollments, work out things like premium payments, start benefits for Social Security income, although I focus more on the Medicare side, than we have seen in the past. So I think the real name of the game, the important thing that I want people to take away from this, is the necessity to really be proactive in the timeline that you need to accomplish when it comes to Social Security income or Medicare benefits. So let's talk about the timeline for Medicare. 3 months before the month that you turn 65. So just as an example, if your birthday is in June of 1960, then you'd go back May, April, March. March 1st is the first day that you were able to say, okay, I want Medicare. I want to get enrolled in Part A and Part B, and send that enrollment request to Social Security for Medicare Part A and Part B. That is taking longer than it has in the past. I've seen people really get close to that Medicare start date and still not have the information that they need to select their additional coverages. I've also seen some people get it quicker than I've ever seen it happen before. So I'm not saying it's impossible. I just think the very best advice that I could give you is to be proactive about your timeline. Really, when you have that 3 months before you turn 65, I think the very best time to call is 4 or 5 months before that birth month. So we can find out, do you even have to explore Part A and Part B? Like, are you still working in a large group? Do you have insurance through a spouse's active employment? Or is Medicare really something that we have to get going for you? If we do that 4 to 5 months before the month that you turn 65, we'll be sure to give Social Security and Medicare as much time as we possibly can to get those requests done for you. So be proactive, start 4 to 5 months before. You can actually, do enrollments until 3 months before, but at least you'll know exactly what's expected of you, and you will allow as much time as possible. The other thing that I've seen, there is a lot of talk in the news about Social Security fraud, whether it's real or not, I'm not going to get into, but I have seen that Social Security has made 2 pretty significant changes to requesting benefits, so new benefits and changes to benefits. The first one is that you'll no longer be able to do those requests via phone. That was a really significant way that people have typically approach their Medicare and or Social Security income request. They've scheduled a phone appointment with their local office for a date in the future. That was all handled by phone, so a little bit easier. Now, you're really going to have to visit in person or handle those enrollment requests online. That's a pretty big, significant shift. So if you have questions about that, certainly let us know. I think that setting up a Social Security account is a great thing for someone to do. I have already done mine. It really does help to have that done. But I know everybody's not comfortable with online stuff all the time. So being familiar with your local office, scheduling that in-person appointment sooner rather than later, because they will book out a while. Those are really good practices, especially in the environment that we're in right now. And as far as also identity and fraud stuff, in addition to not doing things over the phone, Social Security is utilizing AI, artificial intelligence, to determine potential fraud or suspected fraud. And we've already had 2 people who've had to either go to a local post office to confirm their identity, or upload a photo from their phone with a copy of their state-issued ID in order to make changes or apply for benefits. So I think those 2 things, the inability to do things by phone and also the enhanced fraud protections are really the things with the Social Security Administration that are going to have an impact on people's daily lives and the processes. So again, starting early is the most important thing. I know it probably feels scary. Things change daily, it feels like. It's hard to say exactly what's going to happen in the future. The things I'm saying the things that I'm saying today could not be the case a week from now. But as it stands now, my very, very best recommendation is to not panic, to engage with a professional 4 to 5 months before you need Medicare, so either turning 65 or if you're past 65 and now you're getting ready to retire, so that we have enough time and you don't really feel under that strict deadline to get things done. And also just being prepared for a little bit of extra work for maybe identifying or confirming identity, and going in person for help with Social Security if you're not comfortable with online options. So hopefully by now you know that I always like to give you sort of a tutorial, a little action item just to help you as you approach Medicare and stuff like that. So in addition to being proactive about your timeline, so not waiting until the last minute, that can't happen anymore. But it also is helpful to be familiar with your local office. Where would you go if you need help? Who's responsible for helping you? So I'm going to show you how to locate that using your zip code so that you have a local phone number, the address, fax number, all that good stuff. So I'm going to share my screen. I'm going to put my glasses on. You're going to see a glare from my bright sunny window, which I'm very happy about. Hopefully you're able to see this. You see the ssa.gov locator. You're going to see that you've reached the Social Security Administration. So that's, you're in the right spot. If you notice up here, it's kind of easy to miss. It's going to say if you need to visit an office or schedule an appointment, find out how. We'll click on that link. And then we're going to scroll down because it tells you how to make or change an appointment. Find your local office is going to be helpful. So click on this button and they're going to prompt you for your zip code. I will use Camillus, New York. So here you'll see this is the information for the Onondaga County Social Security Office. Right here, what they have listed is actually the national number. I just happen to know that the local number is 866-755-4884. But when you put in your zip code and you see this, it'll tell you the fax number, the phone number that you could call, and will also give you information about the street address so that it's easy to find that. Not every county has a Social Security office. There's only 1,200 field offices throughout the country. So if you call that national number, that's going to connect you with your regional office. There's 10 of those. I do think working locally is helpful. It's someone from your own community, right? One of our neighbors who lives here, works here, might just care a little bit more to get you help than if you called a national number. So if you aren't able to locate your local Social Security office, when you call the national number, you could ask if they have a better contact number for your local administration. We've learned how to locate our local Social Security Administration. We've talked about the importance of not delaying or procrastinating or putting off applying for things that we need, because we do want to give them as much time as possible to, process our requests and get the benefits enforced that we need. So rely on your local administration, your Social Security Administration, engage with a professional, and hopefully this has settled at least some of the fears with all of the noise that can be out there in the media. 50% of Social Security is not going away, so we know we don't have to worry about that. I really want to thank you for joining today. It really, isn't a technical tutorial educational piece about Medicare, its pieces and parts. But I just do, know that there's a lot of people who are feeling overwhelmed and it's kind of frankly scared about some of the things that they're hearing. So weed through it, we'll get through it, be proactive, and hopefully your Social Security local office will be willing to be a good resource for you. Thank you for listening today. Our next episode, which was supposed to be this episode, but from the phone calls and some of the stress that I'm hearing out there, I did want to address these timely things that are happening in our country. But our next podcast topic is going to be about election periods. So when can I make changes? What timeframes do I have to be considerate of? When can I make changes if I need to? Just making sure we don't miss any of those deadlines. So we're going to talk about election periods. You're really a lot more flexibility than some people think, at least here in New York, for making changes to plans. So looking forward to teaching you all about that in our next episode. Thank you so much. Feel free to like and subscribe. Feel free to send questions to the info@onwithamanda email if we haven't covered something that you're hoping that we will. And we'll see you next time. Thank you. Thanks for listening to another episode of the On with Amanda Medicare podcast. Please make sure to subscribe wherever you get your podcasts so you don't miss an episode. Also, please leave a review as that helps me reach more people that can benefit from this podcast's content. If you have questions or topics you want me to cover for a future episode, please email them to info@imwithamanda.com. I look forward to hearing from you. Like any good industry, we do have compliance requirements, so here's my disclosure. We are not a government agency. We are licensed insurance agents who discuss insurance programs such as Medicare Advantage, Medicare Supplements, and Medicare Part D prescription drug coverage. Any specific plan information I provide is limited to the plans I offer in your area. Please contact Medicare.gov or 1-800-MEDICARE to get information on all of your options. Thank you.